Hi, this is Brian Wormers recording a lecture for assessment and care of patients with ear and hearing problems for medical surgical nursing at the University of Sioux Falls. So some of our learning objectives, we'll be talking about common assessments of the ears and hearing, we're talking about common problems of the ears and hearing, and we're going to talk about treatment modalities. So assessment techniques, this is related to posture, appropriateness of responses. Are they interacting with you appropriately? Do they hear you? Do they have any pain, discharge, vertigo, tinnitus, decreased hearing, difficulty in understanding what you're saying, any trauma to the site, any surgery, infections, excess of earwax, are they using any instruments in their ears, trying to scrape out the earwax that could cause trauma? Are they exposed to loud noises, smoking, barotrauma, which is pressure changes related to atmospheric pressures, so pilots and different stuff like that, or like scuba diving. And then are they on any medications that might be ototoxic or have a medical history that might cause some hearing loss? Any family history or genetic risk of this? And then of course we're talking about current health problems. So can't handle loud sounds, tinnitus, vertigo, those kind of things. Physical assessment, looking at the outside of the ear, making sure that it's appropriate. Looking at the inside of the ear with the otoscope, looking for earwax, looking at the tympanic membrane. Auditory, so voice tests, hearing loss. We can go really fancy with this, or we can do some of the simple tuning fork stuff with Weber and Renee. So remember, it kind of looks like a W, so this is your Weber, and you're looking to see if it's balanced on both sides. This is your Renee, looking at bone conduction versus air conduction. Diagnostic assessment, so laboratory testings, we can do some of this stuff, so imaging, looking at the structure of the ear. We can do a lot of auditory assessments. Tympanometry, so looking at how that tissue moves. We can look at bears, so brain auditory evokes response. ENGs, so looking at the electrical impact of this. And then caloric testing. Caloric testing means that you're taking like cold water and putting it in their ear and seeing if they're having a reaction to this, which they should. Hearing changes associated with aging, so their earwax changes, it gets more impacted, it gets drier, and that causes complications with causing obstructions of the ear canal and decreased hearing. The tympanic membrane loses elasticity, so they don't hear as well. The bony ossicles don't move as well. The cochlea get damaged and changes. You're going to have vestibular changes of the semicircular canals, and so their balance can be off. You can have decreased hearing acuity, and they might not be able to hear high-pitched frequencies as often. So one of the first things we're going to talk about external otitis. So this is irritation of the external ear, and so this could be irritation related to an infection or bacteria or some kind of an agent that's causing irritation. More common in hot, humid environments, more common after they've gone swimming. So treatment-wise, we're trying to work with this. Give pain medications as appropriate, give antibiotics as appropriate. Try to prevent it is your best thing. So if they're swimming a lot, you might use oil and vinegar in an ear or some alcohol to try and dry those ears out as much as possible. Furnicle, this is a bacterial infection. So it's basically a hair follicle that gets infected. And so if it gets big enough, it can block the canal and cause complications of hearing. So treatment, so antibiotics as appropriate. Might try to do heat to see if you can get that furnicle to kind of rupture a little bit. Burroughs solution might release some of the pain with that. And if it gets bad enough, you might have to do an IND for that and get it to release the bacteria inside it. Foreign bodies or earwax. This is the most common cause of an impacted canal, causing a lot of hearing problems. And so what we want to do is try and get that out. Otherwise, other blockages include vegetable matter, so not like vegetables like eggplant, but This could be grass, leaves, anything like that. Foreign bodies, beads, pencils, erasers, insects. You have to realize I come from a pediatric background, and kids will put interesting things in there. I've seen all these things, rocks, etc., etc. Insects can fly in there and then cause damage. Sometimes it's hard to get out, and so we can do a variety of different situations with that. If it is vegetable matter, try not to put water with it because it might swell it up and have it more difficult to get out. If it's an insect or something that's live, then that might cause stinging or more irritation of the insect. Oil is commonly used to try and suffocate it, and then you can remove it afterwards. If it's earwax, try and scrape out the earwax, and then give something that's going to try and keep that earwax down. So sodium bicarb has been effective. Otherwise, there's different medications that are for prescription or over the counter even. So irrigation of that ear. So you've got an irrigation syringe, you can do this. Otherwise, if you take the catheter off of an IV cannula and just use that, and you can put that right onto the tip of a syringe, and that works pretty nice for this. When you irrigate it, try and get this kind of deep. If you've got a blockage here, what you really want to do is shoot past the blockage, bounce it off the tympanic membrane, and have the fluid then push this outwards. You don't want to shove it into the earwax or the blockage because you're just going to shove it deeper. So you want to get through this and then create a back pressure of your fluid this way so that it pushes the obstruction out. Otitis media, so these are ear infections, so it could be acute, chronic, or serous. In adults, it's less common than what it is in children because the canals are bigger, and so you get better drainage. But what you're seeing here with this one, you can see this fluid bubble or this air bubble here, so you've got fluid behind this. And this one you can see rupture where you're not having a good tympanic membrane, so you can see your ossicles and your bony prominences here. So with otitis media, what you're going to see is pain, fullness, or decreased hearing of that ear that's impacted, headaches, nausea, vomiting, vertigo. You might see redness of the ear, especially that tympanic membrane. So that eardrum, tympanic membrane is red, thick, and bulging. Loss of loose landmarks, so you can't see the ossicles, and you might even have drainage with it. Non-surgical management, so quiet environment, have the bed up, heat and cold applications as appropriate, antibiotic therapy is your mainstay, pain meds, antihistamines, and decongestants. So often what you're seeing is people get an otitis media after they've had an upper respiratory stuff because you get a backlog through your eustachian tubes, and that bacteria just kind of feeds back up in there. And so trying to open up those with analgesics and decrease the swelling and decrease some of the congestion that they might have really can help out with an otitis media. Surgical management of this, so myrigotomy is a surgical incision of that eardrum. Can include a grommet, so a PE tube that's placed in there. Post-operative care, so we're going to keep that site clean and dry as much as possible. We might instill antibiotics into there. And then we really don't want to have them do sucking through the swallow through a straw because that increases the pressure within there. Mastoiditis, so this is infection of that mastoid air cells. So if that otitis media gets worsened, you can get mastoiditis. So a lot of swelling behind the ears, and you can even get cellulitis of this. So management is antibiotics, trying to fix that, treat that antibiotics. Trauma, so you can get lots of different types of trauma to the eardrum and the ear itself. And so direct damage with cotton tip applicators, cannulating, different things like that. Otherwise, through pressure changes, through atmospheric, so flying or scuba diving or any of those things. Perforations usually will heal in 1 to 2 weeks on their own, but if they continue to happen over and over again, that tissue can scar and cause hearing damage that way. So external, so you might see granulation tissue occur related to trauma on the outside of the ear, common with martial artists and wrestlers, even boxers, hence the term boxer's ears. Tinnitus is a ringing of the ears, so this can be, primary or secondary. It's hard to confirm because we don't have any great tests. It's just going off of what the patient says. But things that we can kind of do with this one is trying to, figure out the cause of it, see if there's any meds that they're on or anything that's changed recently that we can try and reverse. Otherwise, if we can't find the cause, then just try and mask that ringing of the ear with some different background noises, and having some music on while they sleep. Realize that this can have long-term psychological and emotional consequences with this, and it's driven some people mad, so to speak, if they've got this constant ringing in their ears. Vertigo and dizziness. So vertigo is whirling or turning in space, so versus just kind of lightheaded. So this is impacting your semicircular canals, and that works with the proprioception system, so where you're at in space. Causes nausea, vomiting, hearing loss. Things that we can do is try and move slowly, so it's not impacting those semicircular canals as aggressively. Provide adequate hydration, take antivert medications. Realize that this can cause drowsiness and that can cause some complications, and then try to prevent loss of balance accidents, especially if they're drowsy. Meniere disease is a couple of different things, but you're getting tinnitus, you're getting hearing loss, and you're getting vertigo all in one thing, so it's not much fun. Patients can get this after an infection, stress, traumatic injury, or have it even related to allergies. You get endolymphic fluid that gets swollen, and that's pushing on things that it shouldn't be pushing on, and so patients will have these attacks, and of course it can be severe enough where they can't function. Non-surgical management, slow head movements, trying to limit the vertigo. Can put them on a high drops diet, so this is a specialized diet that you can click on here, and hopefully that limits the swelling and the fluids. And then smoking cessation, of course. Drug therapy, diuretics, getting them to have decreased fluid can help. Antihistamines, antiemetics. Tympanic membrane with antibiotics might help with this a little bit. Otherwise, they do have a Meniere device, and that's going to provide low pressure micropulses in that inner ear. Meniere's disease, so surgical management of this. The bad thing about this is it does often cause hearing loss as related to the procedure. So, but the surgical management is looking at the labyrinths and trying to correct that as much as possible and decompress the endolymphic tissue. Hearing loss, one of the most common physical handicaps in North America, and so things that can cause it would be conductive hearing loss, any inflammation, irritation, medications, blockage of the external canal. Could cause sensorineural hearing loss, so loud noises, drugs, especially NSAIDs, Gent. Might have proboscis, atherosclerosis, hypertension, prolonged fevers, Meniere disease, diabetes mellitus, or history of ear surgery. So with that, we talk about conductive hearing loss, kind of be it on the outside, sensorineural hearing loss on the inside. With that, you could have both. Treatment-wise, you can have hearing aids that go in the ear canal. Otherwise, you can have hearing aids that are going to be more on the outside, like cochlear devices. Medical management of this, so early detection, so, they might be turning up the volume, can't hear conversations, or they withdraw from conversations because they just can't hear. Safety measures related to hearing loss, dietary changes, so we want to provide adequate hydration and nutrition, and then we might treat it medically if there's a good medical treatment for this. Can do surgical interventions with this one, so PE tubes or tympanostomies. We've talked about that for otitis medias. Might need hearing aids or cochlear devices. Communicating devices, so hearing aids like we talked about up here. You might do lip reading, sign language, or speech therapy with this, and then provide them with community resources such as support groups. Alright, that concludes this lecture. If you have any questions, please contact me.